I'll give you an example of that, as it just so happens, it just happened to me yesterday. I would say when I first started with my practice, it was almost 20 years ago, a patient came in with bright yellow eyes. And she had no pain at all, but she had started losing weight. So, to anyone in my field, if you see someone with bright yellow eyes that has no pain, all kinds of sirens and whistles and red flags go off. It's called painless jaundice. And you have to look for all the potential causes, but usually it's because of a pancreatic cancer, 9 times out of 10. And she was a very nice woman. I guess this was back in 2002. And I tried to keep what I knew she had hidden from her vision with my eyes because I knew it was bad. But I told her what we were going to do, and I did scans on her, I did blood work, and unfortunately, I had to do an ERCP, that test where we go into the bile ducts. And I went in and I did some brushings inside of her pancreas, and I could see that there was a cancer inside of her pancreas, and I put a little stent through, which is a little plastic straw almost that allows the bile to flow out, so it'll help alleviate some of the yellowing in her eyes. But ultimately, she needed to have surgery for her pancreas. And anytime that you hear pancreatic cancer, it just makes your gut tighten because the 6 month mortality, which means your likelihood of death in 6 months is pretty high. You're not going to survive 6 months. You're just not. The odds are against you. But she went ahead and did the surgery. She had some chemotherapy, I believe. And again, 8, 9, 10 patients out of 10 are going to die from this in 6 months. Well, I'm happy to say I just saw her yesterday, and it's almost been 20 years. Okay. She had a little heartburn, which is why we were talking, but I almost get a little tear in my eye every time she comes to see me. She's older now, but she's a miracle. Every once in a while, those types of things happen that just make you feel good. With all the troubles in the world and the stress and the fatigue and the financial hardships, I'd say all of us, we did this for a reason. There are other things that we could do to make much more money, to have much more lavish lifestyles. But we didn't do it for the money. Ultimately, we did it to help people. And we have an innate joy of when we're able to do that. So when I have patients like her come in that I was actually able to help as part of a team, save her life, and I still get to see her and talk about her great grandkids now, it does make it worth it. And over the years, the longer you practice, those stories come about a lot. There's a lot of negative ones, but you focus on the good things that just keep you going. So I just saw her yesterday, and it always brings me joy. Even my staff see that I smile a little bit more when I see her name or when she comes in. So that's why we do it, and that makes it worth all doing.